I'm Bhavini Nagar, a Public Relation Officer of Center for Knee and Hip Surgery. Today we have with us Mr. Faud Mbarack, who has come from Kenya, Mombasa, and recently has undergone knee replacement on both his knees. Mr. Faud, you have come all the way from Kenya, Mombasa. What made you choose this India, Baroda, and Dr. Bharat Modi?
If I were to answer that question, I'd first of all have to give you a bit of history, because Baroda is not my very first point in India where I could actually say I started this experience. My very first point that I ever visited was in Chennai. I went to Chennai and we visited MIOT Hospital, MIOT, where I met up with Professor Mohandas, who was the owner and the proprietor of the hospital. Very impressive hospital, very big structure of hospital, but I must sadly say that I actually underwent not a very pleasant experience. And the reason I say this is it's, in my opinion, very unprofessional to forget a patient. What they did to me, basically, after agreeing, doing all the tests and the MRIs of my knees, Professor Mohandas, after studying them, basically diagnosed me and said, something very simple, you need 20 minutes of surgery, and you come in at 6 o'clock in the morning, by 4 o'clock in the evening, you go home. For me, this was a big relief compared to what I was feeling. So I actually checked into the hospital at 6 o'clock the next morning, as per instructions, and all the pre-ops were done. I was then taken into ICU, ECGs, blood tests, everything. Unfortunately, for reasons I am not aware of, they totally forgot about me in ICU from 6 in the morning up to 5 o'clock in the evening. And to me, this was probably the worst experience I've ever had in a medical experience, because being in ICU, one, you're exposed to things that you shouldn't see on a day-to-day basis. Anyway, to cut a long story short, basically, I did not allow them to proceed further, because if they were that negligent about me as a human being, I wasn't about to allow them to touch my knees. I actually flew back from Chennai, back to Kenya. How I got to come to Baroda was through reference of a very, very close colleague or brother. I'll actually call him a brother. He's an optician. His name is Murtaza Somji. He had brought his mother, who actually resides in the UK, to the Center for Knee Surgery, to Dr. Bharat Modi. And after she had her knees replaced, she developed such a remarkable recovery that even the children themselves had not ever anticipated that they would get such results. So this gentleman actually called me and said, look, I think I found the right place for you. And because of our very close relationship, I decided to embark on a second trip to India. Very concerned, but I came to India. I came to India last year and a few months, and met up with Dr. Bharat for the very first time. We had a very long discussion regarding my condition. He went through all the MRIs and the X-rays that I had actually come with, which I had brought along with me from MIOT Hospital. Okay. They had also did an X-ray here for their own assessment. And what I could pinpoint as a strategic decision maker for me was the actual candid and straightforward approach about my problem. And not just somebody telling you, your problem is something small, we'll sort it out in 20 minutes. Dr. Bharat took the trouble to actually go deep into the explanation as to what was actually happening to me, for me to get a better understanding. Fortunately, I managed to get him, rather we managed to come to a consensus that, okay, I need to have my knees replaced. Dr. Bharat was actually unwilling to actually replace my knees due to my age, which, based on, I think, medical practice, I was a bit too young at the time. However, he did say that we could still undergo the same arthroscopic surgery that was being recommended in Madras to try and relieve the situation because of what is going on in the knee, and try and gain a few years, so that as I aged, then when we come and do the replacement, which was an inevitable conclusion at that point. So we underwent the arthroscopic surgery, and it was done in a day. I think 5 days later on, I was actually on my way back to Kenya. We kept in touch with Dr. Modi over time. My knees did not actually give me the relief that I had hoped I would get, but I must also be fair to the doctor that he had actually made it very clear that he asked me what I was expecting to get out of this, and I told him, look, I'm not expecting to run the mile in 10 seconds. I'm just expecting to get some normal walking out of it. Right. He was also very honest that he did not know to what degree the arthroscopic surgery, how far it would actually help me, because the condition of my knee was seriously deteriorated. But at least he took off all the sharp points, all the hanging cartilages, which I personally saw on the screen. Right. So he cut all those out so they don't get lodged between the knees. So he did what he could do. The situation got worse, and the pain got more, so much so that even standing for a minute and a half in one position would actually create like a locking sensation and extreme pain in my knees. I managed to get I had to go to a business trip to Germany, and in course of that business trip I decided, let me get a second opinion, and I went and I visited a specialist in Germany, in Munich. And I was actually very relieved to get from the doctor there a replica of the diagnostics that I had gotten from Dr. Modi in the first place. It's sometimes it's terrible to go and say, what you've done is wrong. But when you go there and the doctor tells you, without telling him the history, he tells you word for word, literally word for word, exactly what you were told in Baroda. Right. The only suggestion that the doctor in Germany made was that he had, because of the x-rays that he took, he found that the inner part of my knees were actually touching. So he actually recommended that we do a partial replacement rather than a full replacement, again for the very same reason, to buy time due to age. Because of the comments the German doctor gave me, and because I found that it's identical to what Dr. Modi, I decided to refer the whole case back again to Dr. Modi. And when I referred the case back to Dr. Modi, we again back and forth communications regarding the situation and what was his opinion. I gave him the doctor's opinion. Everything was put on the table, what the doctor in Germany had said. And Dr. Modi actually came up with a very logical argument, in the sense that he said, okay, a partial replacement he could do as well, but all I would be doing is subjecting myself to an additional surgery in the course of my life. Why not do the total knee replacement surgery and see, only God knows, it could be once and for all, or if you live that long, you can come and have a second one done. So, but if you do the partial knee replacement surgery, it's a foregone conclusion that you're going to come back in a short period of time for the total knee replacement. This made a lot of sense to me, and basically this is why I came back to the center for the second time. And I'm actually very grateful to say that I have now replaced both my knees. My recovery is, I'm not a specialist, but according to me, the pain of standing I don't feel. I am a bit stiff, but we're getting there.
Right. According to you, what makes a center stand out from other hospitals?
I would okay, this one is something that is a bit difficult to explain, but to explain it in simpler terms, this is not a center, it's not a hospital, this is more like a home. The difference, and I can refer this to almost any hospital in any place in the world. In a lot of hospitals, you're a digit. You are a patient, you're a number. At the center, through my experience, both times, I've been here twice, you're a human being. That's all I could say. They treat you like a human being, they care, they understand that this is a discomforting experience, they understand that it involves some pain, they understand that you have traveled and you're out of your normal comfort zone, and they try to bridge this gap. This is the key elements about the center that I would have to say that my experience is.
What has been your experience after came here and your operation has been done? And how you feel about this?
I expected the whole process to actually be a bigger process. And when you have your knee replaced and then the next day you are told stand on it, I mean, this is by any terms is not a joke. I mean,
Right.
but when you do finally actually take that walker and you actually stand on your knee and you recall the pain that you used to have and you don't have that pain, I think it gives you such a level of satisfaction that it's a bit difficult to explain, but it's satisfying. It is satisfying, and it gives you the courage to actually endure even more if necessary and get on with it.
Many people in the society, they are suffering such kind of knee pain, and they are afraid of going under this surgery. What message you want to convey to them?
I would ask them to simply assess the quality of life that they have and what do they want out of life. And if you are actually somebody who wants to be a burden on others, because if you're immobile, you may not realize it, or by virtue of your age, because normally this affects senior people, you feel that it is a duty for your junior people to look after you, but you may not realize you don't have to suffer. There may not have been options before, but there is an option, and unless you've tried all the options, you should not just limit yourself to a bed. This is not life. Life is not designed for us to sit in a bed and have everything done for us. I would suggest to anybody who is actually suffering from knee problems to evaluate the situation, get the professional people to evaluate it. If necessary, have the replacement done when you are still in a physical state. Like in my particular case, you cannot compare me with a 75-year-old lady who was my motivation, by the way, here. My recovery has been quicker by virtue of my muscle tone. Do not allow your muscle tone to completely deteriorate and then say, I want a miracle. It doesn't happen. You have got to dedicate yourself. So while you still have some muscle tone left, get it done. That's what I say.
Do you think you should suggest your relatives and friends for this surgery at center?
It's very, very funny you should actually ask me that. Before, when I did my arthroscopic surgery and the experience that I had, even then I had taken catalogs, and I had also been talking to a lot of people in Kenya about the center. I mean, what I have seen, I mean, I was here, I have seen with my own two eyes, and I'll give you an example in Kenya. In Kenya, it's not that they don't do knee surgery operation, they do knee replacement operation. But the difference is, they'll probably do one knee replacement in 5 years. Whereas at the center here, I have known them to do up to 5 a day. Now, practice makes perfect.
That's true.
The center being a center that has specialized around that particular joint and the hip joint has limited its speciality, and hence has become a much more efficient instrument in dealing with that instrument. I would very confidently and very proudly actually say that I would recommend this to anybody who needs it. I have actually taken some correspondence back. I'm going to take some correspondence back from people who've made inquiries. I am physically going to visit them, because if I can change somebody's life, what more do you want?
Nothing more.
Nothing more.
That's right. Yeah. Thank you, Mr. Faud, for this interactive session. Thank you very much, and we hope and we wish you a speedy recovery for your operation, and have a good life ahead. Thank you very much. Have a nice day.
I just want to add one more thing. I hope to come back to Baroda,
Definitely.
but not to the hospital, as a visitor.
Yeah. Definitely. I wish. Thank you.